It's terrific to see such a strong audience straight after morning tea. I know we've had a really busy and interesting opening session, and in fact, opening session to what has been a really busy and interesting few days. It's great to see the stamina of the crowd here this morning, to think that you're still here on our final day. Terrific to have you at this session, positioning eye health as a national priority from strategy to systems. So what we're going to be examining over the next hour and a bit is the way that strategy to systems informs the Global Summit for Eye Health, how we move from talking about action to actually delivering commitments on the 2nd of November and carrying out those commitments through into the years that follow. We have a really great panel with us today who will be discussing ways to catalyse action, and actually we'll be able to learn from them the tricks and tips that have worked for them in the delivery of their programs and engagements on this summit journey. But to begin with, we have a very, very special guest with us. We have a diplomat from Antigua and Barbuda who is here to give us a welcoming address. I, in a moment, would like to welcome to the stage First Secretary Claxton Derby from the Antigua and Barbuda Mission to the United Nations. Claxton is, of course, a great supporter of IAPB and the UN Friends of Vision, but he is also the First Secretary and personal assistant to somebody who is very familiar to all of you, Ambassador Aubrey Webson, in the New York office of Antigua and Barbuda. Claxton has worked extensively in our sector, but has also been a coordinator for the Small Island Developing States Alliance. And we're delighted to have him here in Nairobi today to welcome us to this session. Thanks, Claxton.
Good morning, Excellencies, distinguished guests, colleagues, and friends. It is a pleasure to join you today at 2030 Insight Live Kenya on behalf of the government of Antigua and Barbuda. I would like to thank the International Agency for the Prevention of Blindness, IAPB, and all the partners involved in convening this important dialogue. As we move closer to the Global Summit for Eye Health, the international conversation is increasingly centered on a fundamental question: how do we transform global commitments into sustained national actions and measurable impacts for people and communities? For Antigua and Barbuda, the answer begins by recognizing that eye health is not only a medical issue, it is intrinsically linked to human development, education, productivity, independent living, social inclusion, and economic resilience. This understanding has guided Antigua and Barbuda's leadership at the international level. Through the leadership of Ambassador Walton Webson, permanent representative of Antigua and Barbuda to the United Nations, we funded and continue to co-chair the United Nations Friends of Vision Group, helping to elevate eye health across the United Nations system and within the broader 2030 Agenda for Sustainable Development. Together with partners across government, civil society, developing agencies, and private sector, this work contributed to the adoption of the United Nations Resolution Vision for Everyone, alongside WHO commitment on integrated people-centered eye care and the global eye health targets for 2030. However, global mandates alone are not enough. If we are serious about delivering on these commitments, we must demonstrate what implementation, coordination, and sustainable delivery look like in practice. This is one of the reasons Antigua and Barbuda has advanced the Blind Free Zone initiative. The initiative seeks to reduce preventable blindness and vision impairment through a comprehensive, community-based model that combines early detection, access to affordable eyeglasses, surgical intervention, workforce development, and strengthening of local eye care systems. Through partnerships involving the Ministry of Health, Wellness and Environment, Cure for Blindness Project, Restoring Vision, Vision Spring, and other international partners, Antigua and Barbuda is bringing eye care closer to communities while simultaneously building national capacity for long-term sustainability. Already, this initiative has secured approximately US $90,000 worth of specialized atomic equipment, along with a commitment of more than 25,000 hours of professional training for local healthcare personnel. In addition, 4 Antiguan and Barbuda nurses are currently undertaking advanced atomic training at Arvind Eye Hospital in India and will return to support the establishment and operation of community-based eye care centers throughout the country. This initiative has also secured 25,000 near vision glasses, helping expand access to one of the simplest and most cost-effective interventions available. Collectively, these efforts are creating a blindness-free zone model that demonstrates how political commitment, evidence-based intervention, and multi-stakeholder collaboration can be translated into stronger eye health systems, expanded access to care, and better outcomes for communities. Importantly, this initiative is not solely about delivering services today. It is about strengthening local capacity, ensuring long-term sustainability, and embedding eye health more firmly within national development priorities and planning framework. It also reinforces an important lesson many countries are recognizing globally. Sustained progress requires coordinated actions across sectors, supported by investments, shared accountabilities and partnerships, and a commitment to integrating eye health within broader development agendas. In this context, eye health must continue making a case not only as a health issue, but a practical investment in people, productivity, and inclusive development. The Global Summit for Eye Health represents an important opportunity to build on this momentum. It is an important opportunity to strengthen accountability, mobilize meaningful commitments, and align governments and partners around practical actions that deliver measurable progress. Equally important, it provides a platform to showcase and learn from initiatives already translating ambitions into action. We hope that Antigua and Barbuda Blind Free Zone Initiative can serve as one practical example of how national commitment can be transformed into sustainable delivery and measurable progress. While every country and region will pursue its own path, lessons emerging from this initiative may help inform policies, partnerships, and actions far beyond Antigua and Barbuda. The summit now challenges us to move beyond commitments as statements of intent and focus instead on the systems, partnership, financing, and accountability required to deliver real results. The question before us is no longer whether we understand the importance of eye health. The challenge is whether we are prepared to build the systems, partnerships, and political momentum required to deliver on the commitments we have already made. Antigua and Barbuda remains committed to working with partners across the region and sectors to help advance that shared objective. I thank you.
Thank you very much, Claxton. I can tell you that we are all really excited for the summit in Antigua and Barbuda, and many of us are looking forward to seeing you there in November. But could I have, please, a big round of applause for Antigua's leadership on this issue? Now, for those of you who I may not have met, my name is Drew Keys. I'm the Director of Regions Engagement for the IAPB. And in this summit year, I have the best job in the world. I have a really exciting opportunity to move around the world, meeting health ministers, meeting foreign ministers, driving their engagement around the global summit, but more importantly, working with many of you in the room to get those commitments for the 2nd of November. Making many friends, meeting many really, really strong advocates, and I'm honoured today to have some of them with me on the stage. The first person that I would like to join me on the stage for a fireside chat is the Chief Global Affairs Officer of Restoring Vision, a huge friend of IAPB, a really strong advocate. Please welcome Her Excellency Ambassador Ms. Keisha Maguire.
What an introduction.
Keisha, thanks so much for being with us today. You have been part of our IAPB world for only a relatively short period of time. And in fact, many of our friends in the audience may not be aware that over the last few years, you have moved from being the permanent representative of Grenada to the United Nations through to your position now at Restoring Vision. It is a really great example of elevation in action. You're a walking, talking model of elevation for our sector. So, Keisha, tell us a little bit about your story. How did we get here?
Sure, no, and thank you, first of all, Drew and IAPB for having me here today and for convening such an electric week. Insight Live Kenya, this is the first time, I mean, as you correctly said, I've only been here in this particular side of this, this space since last October. So not even a year as yet. But as you said, it's been a bit of a transition. But you know, you said, how did I get here? And I would posture that I was always here. And really and truly, it's because I see this as a path. You know, it's just a continuation of my path of a mission that has always been near and dear to me. As you've mentioned throughout my diplomatic career, I was the UN ambassador for Grenada. I also, during my tenure as ambassador, I served as a vice president of the UN General Assembly, and I also thereafter was in the senior cabinet of the UN General Assembly. So I've had that sort of side of it. But for me here now, and I think throughout my diplomatic career, and I think this holds true, the fundamental question has always been, how do we create the conditions, right, such that people everywhere can thrive, right, that can live up to their potential? So in many ways, for me, and I was a little tongue-in-cheek when I said that I was always in this space, but in many ways, my eye health journey began long before Restoring Vision, and actually even before my time at the UN. At the UN Grenada, I was there when we had the founding of, under Ambassador Webson's leadership, we had the founding of the UN Friends of Vision. So Grenada, when I was with PR, we were a founding member of the UN Friends of Vision. But even before that, and you would have heard me say many times, Drew, and I'm sure everyone that I've met here in this room would have heard me say, I am a daughter of an ophthalmologist, and the daughter of an ophthalmologist that was the only ophthalmologist on my island. I hail from the beautiful island, the spice of the Caribbean, Grenada, and we like to say Grenada, Carriacou, and Petit Martinique, because we have 3 main islands. And then I'm also now the sister of an ophthalmologist. So I have seen, growing up, firsthand the transformative impact of restoring someone's sight. And really and truly, what has attracted me to Restoring Vision was realizing that vision is one of the most pressing, but more importantly, overlooked barrier to human potential. You know, something as simple as this 700-year-old invention can not only just restore someone's sight, it restores their livelihoods, right? It restores their dignity. It restores their independence as they age. I mean, think of it. We all, if you can't see, many times you cannot perform. You cannot work. You cannot earn, right? You cannot provide for your family, right? So it has such a transformative impact. So for me, my role at Restoring Vision, as you mentioned, I'm the Chief Global Affairs Officer, and what that does, my role, is to have that kind of connection between government engagement and the global advocacy. So you have that intersection. It squarely sits at the intersection of diplomacy, of development, and implementation. So I am very happy to sit in this role. It is an honor for me to be here, to have this discussion with you, and to be in this space and contribute in any way I can.
Thanks, Keisha. It's a fascinating story, and as you say, you sit at this intersection point. You sit at the intersection of diplomacy and leadership and the eye health sector, and you also come from a family that is so integral to the eye health sector. So, from this perspective, how do we move eye health from being seen only as a health sector issue to a true national priority?
You know, I think that's an excellent question, Drew. And I think the first step, really and truly, is changing how we frame the issue. You know, for far too long, eye health has been treated primarily as a health sector concern. You know, but when you look at the evidence, and we have, of course, the IAPB Value of a Vision report, it becomes crystal clear that vision is fundamentally a human capital issue, right? And vision, I say many times, and I'm sure you've heard it in other interventions that I've had, but vision can no longer sit on the sidelines of global health. You know, it must be embedded at the core of how we think about economic growth and sustainable development. So we at Restoring Vision use this term, visionomics. And we use it to describe the intersection of vision, health, and economic participation. Because, you know, to elevate the eye health issue, it's not just taking the leadership or only the Ministry of Health taking leadership. It requires leadership across ministries. You need your Ministry of Finance. You need your Ministry of Education. You need your Ministry of Social Development. You need your Ministry of Labor. We need to take that kind of cross-sectoral approach with intra-ministerial. But you also need the other sectors. You know, the private sector has a clear stake, right, in their workforce being able to see and perform. And let's talk about the development community. They must recognize, right, within the development community that vision, eye health, is actually an accelerator for the achievement of the Sustainable Development Goals. It crosses over at least 7 to 8 SDGs. So I think when we have that sort of paradigm shift, not only in the narrative, but in the perspective and the viewpoints that we bring, eye health stops being only a health issue and becomes a national development priority.
Keisha, as you were talking then, I was reflecting that often when we talk about these big thinking ideas, we automatically think about large countries, the countries that are seen by everybody as the global leaders. And I want to take us for a moment to a much smaller country, to Antigua and Barbuda, which is, of course, a leader in their sector. We heard Claxton talk earlier about the blindness-free zone. That's a legacy of the work that's being done in Antigua for the summit. And I know, of course, that Restoring Vision is involved in this project. So thinking about this, Antigua and Barbuda as a small state but a leader, there's a suggestion there that scale doesn't matter, but what advantages can come, what unique opportunities do smaller countries have in driving change like this?
You know, I think one of the greatest advantages, you know, we have a saying, you know, no man is an island. And I think being in a small state, what we have, and one of the greatest advantages for us is our agility. Right? In smaller countries, we have generally shorter decision-making priorities, pathways. We have stronger relationships across institutions. We have a greater ability to align the leadership, the policy, the implementation, and the community engagement across a common or shared objective. You know, and you know, you mentioned the blindness-free zone project that we have in Antigua and Barbuda, and we have the honor and really the privilege, and it's so exciting to me, you know, about the collaboration. We have with Cure Blindness Project, we have with Vision Spring, of course, the Ministry of Health of Antigua and Barbuda, and other actors that we've also brought into this project. And it really and truly shows you the crux of what can happen when you have that collaboration. So when I say there's, you know, man is an island, that we always hear, you know, and is a mantra we use throughout, and maybe because we lived on small islands, but it's because in a small country, you know, collaboration and partnership is, you know, it's not a nice to have. You know, when you have constrained resources, right, it becomes critical, it becomes essential, a necessity, and it's not an option for us. And I think the unique ability of small states to serve as what I would call like a petri dish for innovation, you know, innovation laboratories, you know, we're able on a small scale but a national scale, get to test integrated approaches, demonstrate what works nationally, and generate lessons that can then be replicated and shared at scale. So again, for me, while scale may differ, certainly the ambition is no less in a small state. And small countries get, oftentimes have the most creative, most impactful development solutions coming out of that ability to be able to test on a national scale, but de-risk because it is small.
And of course, you work across many countries, multiple countries, some of them much larger. You've just mentioned a great example of a partnership. Is there a secret ingredient? What makes partnerships, cross-sectoral partnerships, work?
Right. I would think, I think there's three things. You have to have the shared objectives. I think you have to have the clearly defined roles. And I think critically, if we're talking about making it sustainable and systems change and systems strengthen, we need to have accountability, right? For us, in our partnership here, each partner brings their unique, something unique, a comparative advantage. So when you ask me for this, the magic ingredient, the secret sauce, I think it is that partnership, it is that collaboration. But in this project, the real secret sauce is the government engagement, the national ownership of this issue. Because, we like to say, and I see our board member here, Reed, is here with us today, we say all the time that we want to work ourselves out of a job in this space. And what does that mean? It means that success is defined where we are no longer needed because we've had the systems change, the systems strengthening, and the government itself is able to take it over, and the society, because you also, as I mentioned, it's not only governments, right? Governments could create the enabling environment, but the private sector has to see that this is the high return investment, right, for itself. It's maybe obvious for us, but we have to make the case. And I would always credit IAPB for the speed at which we have brought this agenda to the global stage, moving within just 5 years. We now have a leaders high-level meeting, a summit-level meeting. But it's because you were able to collate and present the investment case.
Fantastic. Thank you. Everybody, thank you very much to Ambassador Keisha Maguire.
Thank you, Drew.
I'm going to invite a few more friends to come and join us. As I said, I'm really, really lucky to have a panel from right across the globe. So if I could call to join us on the stage, please, Mr. Frank Heder, the IAPB Latin America Sub-Regional Co-Chair for Brazil and co-founder and coordinator of Social Impact in Eye Health Brazil. Dr. Okolo Oteri, the National Coordinator at the National Eye Health Program, Federal Ministry of Health and Social Welfare, Nigeria. Mr. Fernando Botelho, the Assistive Technology Program Specialist from UNICEF. Ms. Louisa Sirit, the Head of Global Partnerships and Positioning from the Fred Hollows Foundation. And Ms. Nadia Defern, the Associate Director, International Public Affairs at Santen. We've got one chair short, so I'll move to the lectern. So as I said, we have with us a really exciting group of panelists. I've mentioned that they represent a broad variety of regions and countries, but they also come with us with a very interesting set of different perspectives that will inform our journey towards the Global Summit for Eye Health. I'm going to begin, though, with you, Dr. Oteri. I had the great fortune of visiting Oteri in Abuja in March this year and seeing firsthand the Nigeria experience in action. But I'd like to ask you to tell our audience, to discuss with our audience the Nigeria experience and what has been most effective in moving eye health in Nigeria from a technical health issue to a recognised national development and policy priority.
Thank you very much, Drew, for that question. I'm happy to be here and to share Nigeria's unique experience. Now, Nigeria's journey in elevating eye health to a national issue began several years ago. So for me, I stand on the shoulders of great Nigerians who have worked assiduously over the years across, NGO sector, across the academia, to constantly raise the profile of eye health. But something changed sometime in 2023. We were able to get an open door to the highest level of political, power in Nigeria. And one thing I will say about that was one thing that was powerful about that moment, because on the 1st of September 2023, for the first time ever, eye health made headlines across print media, social media, TV screens. What did we do? On the back of continued advocacy, and then begin to use the economic argument for eye health was a game changer. Now, having opportunity into doors or corridors of power was not just it. What really moved the needle forward was we began to talk about eye health as an opportunity, as an investment. I was in the room that day, and Professor Andrew Bastaros was across the room from my president, and we're talking about eye health. We have often talked about the prevalence, the numbers, but this time we were putting a face behind the numbers. Now, here was a professor of international eye health sitting before my president and telling his own unique and compelling story of how an inattentive child, probably teacher thought, okay, wouldn't really do so well in life, had a complete transformation of his educational journey, had now become an important professor of international eye health just because of a single pair of glasses. And you know how these meetings go. My president had prepared a speech to deliver, and the moment he began to hear that real-life story, the face behind the numbers, he pushed aside his prepared script. Because you see, that economic argument, that human angle resonated with him for two reasons. One, because he also has an accounting background. So it doesn't help for us to continue to keep eye health as a technical jargon, talking about just the prevalence and the numbers. He began to resonate with the message that eye health is no longer just a health issue. It has imperative for social inclusion, for productivity, and all of that. And then he pushed aside his notes and began to tell us a story of how, as governor, implemented an eye health program that reached many people at state level because of a promise he made to his mother. So the truth is that many of our government people, even at the highest level, have their eye health story. But we need to be able to tell the story and to frame eye health in a way that they can connect the link between their personal stories and what they need to do for their population. And then he recalled the promise he made to his mother that giving her access and restoring her sight from cataract blindness, he was going to equally do that for the people. So by bringing that economic argument, we reminded him of a promise he made. And then on the back of that, we are able to generate strong political will for eye health in Nigeria. And usually these opportunities can come in different ways. So you have a political window, or you have a policy window in your country. It could be COVID, it could be a new election. It could mean you going back to the life and story of your leaders and extracting that narrative that resonates with them, that they can understand beyond the technical jargon of eye health. So for 2 weeks, we were able to elevate eye health to a national priority. And then after that, we continue to sustain the momentum. Because the thing about government is that it's not a touch and go thing. You need to be in the room, you need to be at the table. So our eye health policy, Our strategic plan was the strategy. Our stories, our data was the compelling reason that got us into the room. But then we really needed to make structural changes that kept us on the table. And those structural changes, which we are making across sectors in Nigeria in eye health, gives the promise that beyond the initial buzz, beyond the initial promises, we will be able to sustain this value and deliver this economic empowerment, social inclusion, increase opportunities for education for our people.
Oh, Terry, I absolutely love this idea of putting the face behind the numbers, the stories that got you in the door. I think it's absolutely compelling. And sticking with this idea of being compelling, I'm going to turn to Fernando. Fernando, from a UNICEF perspective, what makes eye health compelling within wider child development and systems agendas?
Thank you, Drew. Well, thank you also for the opportunity to be here. I think eye health has such a fundamental impact on the development of a child that it's hard to overestimate the benefits of correcting whenever there's an impairment. Everything from the education, the intellectual development, the social participation, everything about the life of a child can be tremendously influenced by whether that child can participate fully, can access information visually, can see others. I think there's also another element that, and so is the case with health, because if you're able to correct that impairment, all those things that are so much easier and so much powerful to learn when we are young, they become possible. So it's disproportionately large, the impact that you can have, the benefit that you can bring to the life of a person when you're able to bring it at a very early age. And I think that this is well understood, but people need to be reminded. Policymakers don't need just this reminder, but they also need a roadmap. How do I get there from here? And this is where the members of IAPB and its partners come in. We need to bring not just a challenge and an opportunity, we need to bring them the solution of how to get there. And that's where I think our collaboration amongst ourselves, leveraging the strengths of each sector, will make a difference. Because governments are under a lot of pressure these days. There is a lot of expectation for change, for opportunity from the population. And at the same time, there are restrictions and challenges from budgetary to security and other matters that make it crucial that we extend our collaboration beyond the usual suspects. So let me give you an example. What is being funded right now? Well, there is funding going to the care economy, there is climate change-related funding, there is migration-related funding. All of those sectors involve huge numbers of people, affect huge numbers of people, and to the extent that we are able to extend a hand and help them reach everyone in their initiatives, they too will help us reach everyone that needs eye health. So let's be very broad in our thinking, because what we have done so far has been powerful, has been exemplary in many ways, but it hasn't had the scale that we need. We have to think differently, we have to act differently if we want to change the scale of our impact. And there's nothing less that we would accept, given our values, given the reasons we are here, than full coverage. That has to be the new objective, full coverage. Thank you.
Thanks, Fernando. I was delighted to hear you mention a roadway giving people the solution. And of course, at IAPB, the membership has been very involved in the development and implementation of the 2030 Insight strategy. Frank, you know that 2030 Insight strategy places a strong emphasis on evidence, accountability, on data and technology. And from your point of view, how has data and technology influenced the work that you do in Brazil?
Thank you, Drew. From my experience in Brazil, data and technology helped us a lot in very important parts of advocacy. They helped to change the political identity in high health. And in Brazil, those data and tools that IAPB helped give it to us, helped us enormously. And Value Vision gave us the language of return of investment. Vision Atlas helped us bring credibility and evidence. And 2030 Insight strategy helped us think that Brazil is not alone. And this is a global movement, and Brazil is with it, with the global movement. But the most important step was translation, translating these data with the Brazilian reality. And that made a conversation actually stronger. And technology then give us actually a practical pathways to, in a large country in Brazil, digital referral systems, especially telemedicine, and portable equipments being implemented on those remote areas, and better monitoring, and can help connect communities in primary care, ophthalmology services, and follow-ups. Technology is more a bridge between invisible need and accountable care in more effective way. So many messages, the main messages, the message I want to give to everyone is that IAPB gave us a global compass and in Brazil. And our task is to transform that compass into relationships, coalition, political commitment, and national roadmap.
Thanks, Frank. I love what you were saying there about the technology piece, and I was reflecting earlier that the private sector is so often seen as essential to scaling innovation and delivery. And so I'll turn to you now, Nadia. In your experience, what does that effective private sector engagement look like when we're talking about long-term national eye health priorities, when we're talking about systemic change?
Yeah, so as a starting point, I think it's important to recognize that the relationship between the private sector and public health has evolved quite a lot over the few years. So traditionally, we think of concepts like corporate philanthropy or CSR, where the private sector engages in these projects kind of on the sidelines of its core business. But I think, and I don't want to discount that, I think one of the most famous examples of corporate philanthropy is actually from the eye health sector, when Merck donated medicines for its drug for river blindness to over 60 countries. But I think in this context, I wanted to introduce a new concept, or a growing concept, which is creating shared value, which basically posits that businesses can pursue their business objectives and create social value at the same time. And I think that's an important way of looking at especially eye health, where there's a lot of synergies and common objectives. And for us as a company, for example, we've invested a lot into myopia, elevating myopia and children's eye health as a topic on policy agendas. And we've been advocating for example, screening, referral pathways, reimbursement of our products, which ultimately is something that's shared with, I think, everyone in this room. And we also work, of course, very closely with civil society and patient organizations, and we really try to integrate their messages into the messages that we are bringing to policymakers and authorities ultimately. And I think that helps us, not just because it it's very valuable insights that they're bringing, but also because it gives us as a company legitimacy. So I think all of that to say there's, to answer your question, I think we need to move beyond this kind of one-off funded projects and really look at long-term systemic partnerships where we're working closely with all of the other organizations and stakeholders that are involved in the field.
I love this concept of creating shared value. I think it's absolutely terrific. And Louisa, as my last panelist to introduce, Louisa, in the last 9 months, I think we've worked together on an ageing conference in Cape Town, on a gender and eye health conference in Fiji, and we often think of these ideas as cross-cutting. But actually, this notion of shared value, I think, it resonates so much more with what we're trying to do around systemic change for eye health. So with that in mind, Louisa, what would meaningful cross-sector commitment look like in practice if we're serious about embedding eye health in creating this shared value?
Thanks, Drew. Yes, so I think, the 2030 Insight strategy and the UN resolution and the multiple World Health Assembly resolutions all call for the integration of eye health into other sectors. And at the Fred Hollows Foundation, we took up the mantle and started a conversation, and acknowledging Jennifer Gersbeck, who also led with this in the room, we took that conversation up with UN Women. And at first, the feedback from UN Women was like, why would I pick eye health over cancer? I've got the cancer industry coming at me and they want to do something. Tell me why eye health. And so the argument was explained around how cross-cutting eye health is across all the different SDGs. I think it helps that this is a word that's sort of going around perseverance. So perseverance and resilience, we just didn't give up. And we had an opportunity through Australian government funding to take up that mantle with UN Women. And so we produced the first ever joint policy brief on eye health with UN Women, and that's really become a guiding North Star for everything that not just the foundation does, but the sector does around eye health and gender, but also recognising that intersectional approach. And so when you talk about what does the practical success look like, I thought back to a comment that my colleague Annette made in our gender session on Thursday, when she talked about the fact that when she was at school and she couldn't really read the blackboard and she wasn't doing that well, no teacher said to her, let's see how your vision's going. And I think the practical success would be for Annette to go back to her childhood, go to school, not be able to read the blackboard properly, and someone saying, let's do a vision screening. Even better, let's have vision screening just integrated into schooling so that we are, to Fernando's point, catching those children right at the beginning when they've got those opportunities. Moreover, what else does success look like? A woman over 50 who are more likely to have cataracts and probably really slowly disappear from life. Because they can't see, they can't work. Rather than that, let's have that woman go to a clinic for something else unrelated, and also have her eyes screened at the same time and get those cataracts corrected. So I think that's what we want to see. We've got the frameworks. We've talked about the integration into eye health policies across the board in different national governments. But now we need to see the practical application of that by working with those other sectors on the ground and just making vision vision screening a reality right across the board in everything that we do.
Thanks, Louisa. You mentioned a challenge there that you had trying to get eye health into the gender agenda, and it's something we so often see in this sector. It's very often us who are out there knocking on the door, and so that leads me to the next question to all of the panelists, which is around the barriers that we're seeing. So despite all of the progress that we have with 2030 Insight, despite the elevation as we head towards the summit, we know that there are barriers. And so I'm going to ask each of you in one sentence to tell me, or to tell the audience, what is the single biggest barrier preventing eye health from becoming a sustained national priority? I'll start with you, Oteri.
For me, I think the single most important barrier has been echoed in all the conversations we've had in this conference is the traditional siloed approach to eye health. We really need to begin to integrate eye health into the eye health sector across system and service delivery points and multi-sectorally across all other areas of life. So, for instance, in Nigeria, on the back of the presidential commitment, we didn't just say, hey, we're now in the news. What we did was we began to make structural changes. Now, the first thing we did was we launched the presidential initiative to reach people across sectors, within the local communities, because that's where the need is most. And then we, most importantly, drove integration of primary eye care into primary health care on the back of that commitment. Beyond that, we began to expand the opportunities for financing for eye health. So we are now in funding, so opening eye health insurance, increasing enrollment rates for the insurance itself. And we began to see real changes at state level where most of the implementation take place, where state governments began to set aside money in their budgets for the very first time for eye health. So for us, those are successes which we have seen in some areas just by opening up the sector to say, no, we're no longer going to follow this siloed approach. We're going to go open eye health through a whole health sector issue, to a productivity issue, to a social inclusion issue, and to a whole government approach that ensures that everybody is on the table, engaging with the topic, and actually doing something about it within their sector to advance the goal of eye health.
Terrific. And Nadia, what would you say is the biggest barrier to the private sector being engaged?
I would say from my experience, because so far I've worked mainly on Europe, now I'm starting to work outside of Europe as well, but I think we've talked a lot these few days about how eye health is restricted to health and we need to move beyond that and also look at all of these other parts of policy. But actually in some cases, and especially in the developed world, I think there's this assumption that eye health is solved, and so it's not even there in health policy to begin with. So I would say the challenge is this kind of lack of policy infrastructure, if I can call it that, which means that we spend a lot of time just explaining to policymakers what we mean by eye health, why it's important, and so we're stuck on that awareness raising level, and we can't really move into implementation and actually figuring out what projects and initiatives we could be partnering on.
Fantastic. And Keisha, from your point of view, biggest barrier?
The biggest barrier, and I guess you want me to say it succinctly, but I would say the biggest challenge is not, understanding the value of vision or eye health. I think the evidence there is clear, but rather it's translating that political commitment into not only implementation, not only into accountability, but I would say the biggest challenge really and truly is sustained financing. And just building off of what Dr. Okolo has said there, I think and this crosses, in my opinion, across any sort of issue you're addressing on a global scale and then, of course, on a national scale, because these challenges are global, but the solutions are local. But at the end of the day, at the crux of it, you can have the best policies, you can have the political will, but if you do not have an avenue or a gateway to sustain financing, you're not getting out the gates.
Mentioning there that point around political will, Frank, in Brazil, we have an ambassador, a Brazilian ambassador for the Global Summit for Eye Health. Were there any barriers to getting that political engagement?
Yeah, that's really difficult because actually in the country you have to know about the political environment. And the nomination of the ambassador of Iran, Senator Iran, it was really strategic to get all the stakeholders, not part of, most of the stakeholders inside this strategy. And of course, there's a need for the political interest and for the barrier that I thought was more about the fragmentation combined with invisibility, because there are some populations that are not included on the strategy. When the government creates those strategies, mostly they forget about the indigenous people, riverside communities, and quilombolas communities are the African community in Brazil. And that's why we need more political interest and change that political interest that has to be included.
Fantastic. And so finally to you, Fernando, despite the progress that we're seeing, what do you see, what from a UNICEF perspective do you see as the single biggest barrier preventing eye health from becoming sustained national priority?
Thank you. I think that we have seen really, really remarkable experiences, not just within UNICEF, but with many of our partner organizations, demonstrating the value of eye health, demonstrating how to achieve it. But the political commitment, the financing, the expertise, the personnel training, all these elements, what they need, I think, if you had to choose only one element, is a coordinating body that is responsible to keep the process going, to assess the progress, modify what needs to be modified, and scale up whatever is going on for the next year, and do it again and again and again. Because there are government changes, there are economic crises, there are so many changes that happen in each of our societies over time that it's very easy to lose track and to lose prioritization in the way, in what government is doing, in what the private sector is doing. If you have a body that is coordinating the private sectors, the INGOs, the foundation support, you are able to have enough sustainability of that effort over time to see results. As you see results, you're able to maintain that support. And ultimately, you're going to be able to obtain more and more domestic financing for your efforts, because international funding, donors, philanthropy is not going to be enough. If we want to scale, we need to have domestic financing. We need to have multiple sources of funding so that they are not vulnerable to any single variable in our efforts. And then we'll have the multi-decade work that we need to achieve full coverage.
Fantastic. So we're at this crucial juncture. We were in the final few months of the lead up to the Global Summit for Eye Health, and we are all really thinking carefully about the commitments that are needed, not only from countries, but also from the NGO sector, the private sector, from practitioners, from individuals. And so, Louisa, if I come to you, what commitments do you think are needed across sectors to ensure that that healthy aging, that gender is embedded within this sort of wider conversation about eye health and social development?
Thanks, Drew. Yeah, so we've spent a lot of time this year, actually, Drew, myself, Caroline, Casey, Jennifer, others, too many to mention, and we've really been focusing on integrating gender, healthy aging and other areas into regional approaches to the commitments. So in Fiji, in February, we held the Pacific Pathways meeting, where we brought political leaders, high-level feminists, civil society, all together, and we talked about the integration of eye health and gender equity and advancing the Blue Pacific agenda. And what that led to was the Pacific Pathways communique, and I'm delighted to say that that communique, which is calling on Pacific leaders to integrate advancing women and girls' eye health into their commitments, and we're working on a Pacific Bloc commitment as well as individual Pacific country commitments. But we have sent that communique through to all of the ministers of health. This was led by the ambassador for the Global Summit for Eye Health, Her Excellency Minister Cook. Minister Toki Brown from the Cook Islands. She sent it out to all of the health ministers in the Pacific as a call to action for this to be integrated. And as a response to that, we then replicated a version of Pacific Pathways a couple of days ago here in Nairobi, and had a similar workshop on Thursday. And with all the feedback that we've gathered, we've integrated that into what will be called the Nairobi Commitment. We're going to zero draft next week, and we will then again use the platform of the relationships we have with someone wonderful like Dr. Atiri here to send the Nairobi Commitment through and ask for governments in Africa to include women and girls and the other cross-sectional, because we say women and girls, but actually it crosses with healthy aging, it crosses with education, it crosses with all the other sectors. And what is a guiding principle in both of these, Pacific Pathways and will be in the Nairobi Commitment, is that these need to be financed. We need to have the financing behind it. And if I could call on any and all governments in the world, look at the Australia model, where we have a Minister for Women and a Minister for Financing in one role. That means that that one person, who just happens to be a woman, is always thinking about the women's agenda and the broader outcomes that come from that, alongside her responsibilities from the financial responsibilities she has as sort of Chancellor to the government. So big calls, but that's what we need to see, I think.
So speaking of big causes, Nadia, what partnerships or commitments from the private sector do you think are necessary to continue to drive this agenda and to see it on national agendas?
Yeah, so we as a company just started working on our commitment, so we've put together a cross-functional team from all areas of the business, so medical affairs, R&D, commercial, market access, to really make sure that we're identifying all the opportunities across the business where we could be making a commitment. And then I think there's three key things that we're thinking about. One is we don't want it to be just transactional, like coming back to my earlier point, we want them to be structural, so really long-term investments that we're making into the infrastructure and the systems. The second would be we want them to be mutual, and we need them to be mutual in the sense that any commitment that we make, we need the support of other partners, other stakeholders to create the environment that will actually make them successful. So that's why we're having also trying to have early conversations with all of our different partners and those involved in the commitments to make sure that it makes sense in that way. And then the final one would be measurable. I think this is an obvious one, not just for the private sector, for all of them, but I think for us, it's something we're thinking about a lot, because it goes beyond the kind of typical commercial metrics that we're used to keeping track of. So really thinking about how we're going to measure it in a way that makes sense and that is sustainable.
Thanks, Nadia. And Fernando, to you again, what would a meaningful commitment from a development agency look like, or from a multilateral agency look like?
Well, a multilateral agency like UNICEF, I think a meaningful commitment is, for example, to have in its strategic plan the target to screen 90 million children and provide them with the services and assistive technology that some of them will need. And this is what we have in our strategic plan of 2026-2029. I think an equivalent commitment can be found when you see a donor agency, of a funding entity, having its criteria for its grant making, for its loans, have criteria that take into account the need to make sure that whatever activity is taking place is inclusive. And that means that it will include people that have a visual impairment and their needs for corrective devices like eyeglasses and so forth, or people, children in our case, with disabilities, or people who are internally displaced people because of humanitarian emergencies of various kinds, environmental emergencies. So I think those commitments are really a commitment to be broad in the way you design your programs, in the way you design, you develop the criteria for your funding. Because when you're broadly based, think about it. If you're coming to a politician, a political leader, if you're coming to industry, you're coming to them with just one small segment, one segment of the population. It doesn't have to be small. Yes, you will have the support of that population, and you have the benefits of achieving those goals. But if you want to be really sustainable over time and scalable to the entire population, you want to make sure that you include as many groups as you can. You want to make sure you're inclusive. So if you're doing screening in large scale, why not do hearing screening as well, right? It doesn't have to start that way, but if you think about your work in an inclusive fashion, you will expand it eventually to include hearing screening. If you're doing hearing screening and you have certain entry points, for example, at the time when the child is brought for immunization or at birth. So there are many key moments in life when the child, or even later on the adult, has contact with the health system, has contact with the educational system. If we build on these existing routines, these existing visits, we can get much further. And if we create partnerships, alliances with other groups, with other types of impairments, we'll be that much more effective and sustainable because they will return the favor. And then finally, I think what it comes down to is not just the rights of each citizen, it's the values that we hold dear. I think that's ultimately the foundation of everything we do, and it should not be surprising to any of us that when we follow those values, we are that much more effective in bringing the services that people need at the time that they need it.
Thanks, Fernando. And Frank, to you, thinking about commitments around technology, around AI, around the really remote areas that you work in and the challenges that that brings, what commitments are needed to strengthen the use of data, evidence and accountability?
Actually, the commitments has to be inclusive for everyone, actually. And one of the strategy that we created in Brazil is an alliance where we're gonna actually create a public audience in the National Congress where we're gonna put everybody, every stakeholders, first, second, and third sectors to be all in one, talking about all those commitments. If we're like just concentrating in like the vulnerable people, we're excluding everyone. So actually, we did come up with this strategy with Senator Hiran, that is an ophthalmologist. And I think this can put everybody in the same page and see how we can actually think about all those commitments that the government can do for the next couple of years.
Thanks, Frank. So we're coming quite close to the end of our session, but before we wrap up, I think it would be very interesting to hear from our panelists what success means to them in terms of the Global Summit. And I'll start with you, Dr. Oteri. If you were to sum up success in a short statement, what would it look like?
For me, success would be on two levels, for the sector as a whole globally, and for my country, Nigeria. So for me, success globally, what it will look like is for us to move the needle, to actually see beyond just having conversations, but to see in structural shifts, integration of eye health in all sectors that address every strata of society and all demographics, addresses the women and the girls, the elderly, and all the people that actually need eye health that now do not have access to eye health. And at country level, I want to see us progress beyond the few structural changes that we have made, the political will that we have, gained, to be able to ensure that we have accountability. Because what is not measured is not done. So accountability between government and partners to be able to track how much money is being released, where it is going, and the impact it's making in the short term and in the long term. Beyond that, I really want to see for us commitment to affordability, because it's a significant issue. And that is, in two categories. So at the level of government, for government to be able to make services and eye health commodities more affordable, probably we need to look at import waivers. We need to be able to look at, creating the enabling environment to be able to, ensure local manufacturing of these consumables. Beyond that, we need to expand the private sector. We need to activate the markets, because we need that level of efficiency that ensures that when we create awareness about eye health, when we screen and increase demand for services, that those services are there when they are needed. There is nothing worse than screening, raising awareness, and then people actually go to access those services and they are not there. That will break trust and will be a major problem for us at country level. Beyond that, one important thing I want to see for us in Nigeria is that multi-sectoral governance and partnerships. Very important, like we said, eye health is across, sectors. We want to see in very concrete ways across ministries, across agencies, coming together to address eye health within the context of their mandates. And beyond that also, I want to see meaningful partnerships between governments and, for instance, NGOs and partners that work in Nigeria. We want to see respectful partnerships to ensure that we're able to move government ambition, to technical execution. So for us, that's what we're looking to see.
Fantastic. Louisa, from your perspective, what does success look like?
Gosh, success looks like, commitments from over 50 countries, commitments from INGO partners, from the private sector. Obviously, I'm going to say women and girls being included in those commitments. Otherwise, what am I doing here? All of those things, but that they're financed, that we've got the accountability framework that Dr. Atiri was talking about, and that in 2 years' time, when the next summit comes along, that we can see real progress and we can actually talk about the difference that having those commitments at the summit has made 2 years later. We want to be able to see that change, not just in obviously in the numbers, but actually in the stories. Let's curate, let's hear the stories, the lived experience at the summit, talking about the difference that those commitments have made in 2026.
Thanks, Louisa. I'm going to come back to Ambassador Maguire for the final word. Keisha, from a global perspective, positioning yourself at this intersection of leadership and advocacy, and from your experience, what would success look like to you for the Global Summit?
Yes, thank you, Drew. And this conversation has been very interesting and inspiring as well, both. And I think what we hear, from a global advocacy perspective and how we're going to take this forward, because I always say, of course, the road to the summit is important because that's how we make the summit successful. But I think what is more important is the day after. What does it look like beyond the summit? So to me, it's not going to be just merely the number of commitments we have, but it's the quality of commitments. And how do you measure the quality of commitments? They need to be strong. They need to be intentional. They need to be able to be translated into real progress. And of course, as always, you need to have your accountability mechanism and your sustainable financing pathways. I think we're already engaging, and Drew, you can correct me, over 80 countries. So you're talking about getting investment ready, pipeline of credible projects for the private sector, for the, whether it's the NGOs or the philanthropies and so forth, to invest in eye health, right? So you're going to have this pipeline, but how do we take that forward? How do we ensure that the commitments that we get cross-sectoral is going to translate to improving access, improving coverage? And I think a critical element of that is looking beyond the summit. Where could be the next touch point? Where could we sustain this momentum? We have a lot of momentum now. We have generated it with a summit coming up, but we don't want to lose it. So we need to already be looking beyond the next VNRs. Let's try to get all countries reporting on eye health, because as we know, it crosses over at least 7 to 8 SDGs, and every year you have countries reporting their voluntary national reviews. So to me, in a nutshell, success will look like, from the summit, the quality of the commitments we have and the ability of it to translate to improvement in the lives of everyone, everywhere.
Thank you so much. So audience, if I can summarize this morning's discussion, we need, on November 2nd, we need strong commitments. We need intentionable, translatable, funded, inclusive commitments. We don't want to lose the momentum. And so, in fact, the most important point to remember is that, yes, we're on a journey to November 2nd, but it doesn't end there. It actually starts on November 2nd +1. It's a really exciting time for us in the eye health sector and for all of the sectors that are joining with us on this pathway towards 2030 Insight. And now please join with me in thanking our panellists, Louisa, Oteri, Nadia, Keisha, Frank and Fernando. Thank you all.